That interview with him shortly here on KTN Prime. Away from that, Bomet County has now become county number 20 to report a COVID-19 case. It's one incident causing the total reported cases in Kenya over the last 24 hours to jump to 22 and raising the national tally so far to 737.
Another day, another number in the COVID-19 count. After testing 1,516 samples over the past 24 hours, Kenya now has 22 new cases.
Of the samples tested today, 22 have tested positive for coronavirus. 21 of these are Kenyans, and one is a Uganda national. The youngest is 20 years old, while the oldest is 81 years old.
At a time that Kenya marks a total of 35,432 samples tested, Bomet County is making a debut at the COVID-19 statistics. It has one new confirmed case, but Nairobi and Mombasa continue dominating the numbers.
10 cases from Nairobi, 8 from Mombasa, 3 from Kajiado, and 1 from Bomet.
Again, densely populated areas, according to government, are worryingly among those also posting big numbers. The trend persists across Nairobi, Mombasa, and Kajiado.
In Nairobi, Embakasi has 4 cases, Kamkunji 3 cases, Kibra 2 cases, and Kenyatta National Hospital 1 case. In Mombasa, we have 7 cases from Vita, 1 from Nyali.
The Namanga border with Tanzania also continues raising concern. 3 of the latest cases were traced there. And a mobile corona testing laboratory will be dispatched in the area to deal with cross-border COVID-19 dynamics. Remember, in just 24 hours, 25 Tanzanian truck drivers tested positive and were sent back across the border.
So it was just imperative that we place that lab in Namanga. But if a decision is made otherwise, for example, if that border was, for one reason or the other, not to continue functioning, that is the beauty of having a mobile laboratory, because you simply move it to another desiring site where you can deploy it into immediate use.
In the meantime, another crisis might be in the offing. The healthcare workers' strike notice of May 18th is barely 5 days away.
When it comes to risk allowance, risk is risk. There is no risk for doctor, there is no risk for farm tech, there is no risk for nurse. All healthcare professionals are exposed to the same risk, and therefore the government should give a flat rate risk to all healthcare professionals.
Porous borders remain a headache. Migori and Kajiado among those in the spotlight. And it doesn't get any better for Kenya at a time that 4 more people have died of COVID-19 related complications, bringing the national total to 40 deaths. Mark Namaswa, KTN News.
Now back to that interview with